More or less, it's confirmatory of the long-term benefit from this regimen. I was involved with this trial from the beginning, and so the long term. This is the first time that such a trial is reporting such long-term data in kidney cancer, in the frontline combination treatment in the kidney cancer space. So interesting to note that at the 8.5-year follow-up, we found out that a couple of important things. As you know, ipilimumab and nivolumab, which were approved in 2018 based on the CheckMate 214, they're used primarily for intermediate and poor risk patients with kidney cancer. The favorable risk group, the third risk group, based on IMDC, we don't use in that space because the trial enriched for intermediate and poor risk patients, and also the short-term data in terms of PFS, progression-free survival, was favoring that of sunitinib. So sunitinib did better in terms of progression-free survival. But when we looked at this long-term result, the overall survival data actually are favoring ipilimumab and nivolumab based on the long-term data presented by by the CheckMate 214 team. So was that Dr. Tenier presented, right? Yeah. So overall survival is better in the long run with this, even though the surrogate progression-free survival was better with sunitinib. It kind of flipped in the long term. So this may be a reason to consider, ipilimumab and nivolumab for that indication in favorable risk group, unless it changes the guideline or FDA approves it. I'm not sure it will be used, but that's showing the value of the regimen. That in any trial, we have short-term endpoints like response rate or progression-free survival. And in overall survival is really the, like the gold standard, the harder endpoint. So it's very common to see that the short-term endpoints may not be concordant with the long-term endpoint in terms of immunotherapy trials. And this is a prime example of progression-free survival was better for sunitinib, but overall survival is better for ipilimumab and nivolumab. So that's another trial proving that point. And I think when you look at it, if you ask a patient, would you want, long progression-free survival or long overall survival? Patients would say, yeah, I want overall survival. I want to live longer. So in that sense, this is the value of the data presented. As you know, I was involved with all those trials, which led to the approval. Considering one factor, the durability of response, even though the response rate is lower with ipi-nivo than the others, the durability of response is better with ipi and nivo compared to anything else so far based on the data. So there's plateauing of the PFS and OS curve in this trial. And also there is another reason why the durability is so long, because we recently published, a couple of years ago, we published data from this trial, and one paper mentioned the treatment-free interval. So if somebody had a toxicity and they came off for toxicity, immune-mediated adverse event, vast majority of those patients did not require a second treatment because of the durability of their response and lack of progression in that group. So that's again another highlight of the study, showing the benefit is so long-lived benefit, and I think we can probably reconsider optimizing the the recommendations based on this long-term data.